Hello everyone, Homeopathy Heals welcomes you in today's video. As we all know that February will be the month for diabetes mellitus. So in today's video, we'll be discussing about the types and causes of diabetes mellitus. As we all know that diabetes mellitus is not a disease. It is a syndrome. It is a lifestyle disorder which is characterized by hyperglycemia, which is increase in blood sugar level along with insulin deficiency or insufficiency. My question is that why hyperglycemia is so risky? What are the dangers of increased blood sugar level in human body? Hyperglycemia causes destruction of small and large vessels of human body, resulting in dehydration, ketoacidosis, air hunger, or may lead to death. If hyperglycemia is not so severe or is not up to that extent, it is also known as impaired glucose tolerance, which may also lead to heart disorders. Now, I would like to tell you the normal physiology. As we all know that blood glucose is very essential for energy in human body. And that's why blood glucose is tightly regulated and maintained. As brain cells, they need glucose, but they cannot make or they cannot oxidize free fatty acids. In cases where intestinal absorption is decreased due to fasting or due to long duration between two meals, then liver starts or increase the output for glucose. Liver starts producing glucose from glycogen. Now, I would like to tell you about the insulin. It is very simple. Insulin is an anabolic hormone produced by beta cells of pancreatic gland, and it decreases the blood sugar. And one more important thing is that insulin suppresses the liver glucose output, and it promotes that the other body tissues like skeletal muscles, they should uptake the excessive of the glucose. Now I would like to tell about the types of diabetes. Very vaguely, diabetes mellitus is of two types. It is type 1 and type 2. Type 1 diabetes mellitus is insulin dependent and type 2 is insulin non-dependent. In type 1 diabetes mellitus, it is mainly an autoimmune disorder. It is a T cell mediated diabetes mellitus in which there is complete destruction of beta cells, no insulin production at all. The most important thing about type 1 diabetes mellitus is it is always associated with some other autoimmune disorders or disorders like thyroid, pernicious anemia, or Addison's disease, etc. In case of type 2 disorder, which is insulin dependent, we found the impaired beta cells, and in the human body there is a resistance for insulin. Type 2 diabetes mellitus is very much common in middle-aged people, and it is associated with obesity, hypertension, and increased lipid in the human body. Coming up next are the causes and the risk factors for diabetes mellitus. Sedentary people. Who are sedentary people? Those who are working for 8 hours or 9 hours shift, those who are sitting on only one chair for so long, or those who have very lazy lifestyle, they are more insulin resistant than active people. First of all, there is diet and obesity are the main causes and risk factor for diabetes mellitus. Overeating, no exercise when BMI is more than 30, and so much eating of junk. Why eating of junk and refined food causes diabetes mellitus? Because refined food causes body to increase more insulin. The demand of insulin is increased. Another thing is age. Type 2 diabetes mellitus, as I've already told, it is very common above adults of 50 years of age. Third is pregnancy. During pregnancy, the insulin sensitivity decreases due to the hormones secreted by placenta. That's why if a woman, those who are experiencing diabetes for the first time during their pregnancy, is known as gestational diabetics. Another is drug induced. Some drugs like corticosteroids, they are known for causing diabetes mellitus. As we all know that genetics play very important role, and disorders like Down syndrome, Turner syndrome, Klinefelter syndrome, they are always or mostly associated with diabetes mellitus. And yes, we should not forget about the family history of diabetes of the person, those who are pre-diabetic or insulin resistant. In diabetes mellitus, death usually occur due to metabolic decompensation. So, question for this week is that why diabetes mellitus causes dehydration. Write in the comment section that how you like this video. Like it, share with your friends, and don't forget the answer. The question, I repeat the question again, that why diabetes mellitus causes dehydration. Till then, stay fit, stay healthy, homeopathy heals.